Thank you all for attending today's webinar. This is the second webinar in our 8-part series, Home Matters, Rethinking Aged Care Design, that we're running with Dementia Training Australia. I'm Genevieve Donnelly and I'm Assistant Secretary for the Dementia, Diversity and Design Branch in the Department of Health, Disability and Ageing. I'll begin today by acknowledging the traditional custodians of the lands on which we are virtually meeting. I'm based in Canberra on the lands of the Ngunnawal people. I acknowledge and pay respect to their continuing culture and the contribution they make to the life of this city and this region. I also extend that acknowledgement and respect to other families with a connection to this region and any other Aboriginal and Torres Strait Islander people who are with us here today. There will be a Q&A session at the end of this webinar. Please submit questions in the Q&A function. You may need to click on the Q&A icon in the top of your screen to activate the function before submitting any questions. You can upvote questions that other participants post, and this will help guide which ones are directed to the panellists when we get to this part of the session. There is a difference between liking and upvoting functions. Liking a question won't change its position on the screen. Upvoting will help push it up the list of questions. We will attempt to respond to as many questions as possible. Questions and answers, including ones we may not get to today, will be published in a frequently asked questions document on our website. Questions submitted during the registration process have also been considered for today's Q&A session. We do sometimes receive questions that are unclear or not directly relevant to the webinar. During this session, we will only be responding to the questions relevant to today's topic. Other questions will be directed to the relevant areas of the department and addressed through the frequently asked questions document. There is no option for attendees today to turn on their videos or microphones. Webinar slides are also now available on our website. This session is being recorded too and will be published on our website in the coming days. Today's webinar will provide an overview of the National Aged Care Design Principles and Guidelines. It aims to help aged care staff and designers to understand how the physical environment impacts people's behaviour and wellbeing. I'd like to thank the panel for contributing their time and expertise to today's discussion. Your perspectives help bring the principles and guidelines to life, grounding policy and design guidance in real-world experience and professional practice. Once again, this session highlights the importance of keeping people's lived experience at the forefront of design. Environments that are shaped by what matters most to older people are essential to supporting dignity, independence, and quality of life. I'll now pass to Isabel Meyer from Dementia Training Australia to host today's session and introduce our speakers. Thanks, Isabel.
Thanks very much, Genevieve. Welcome, everyone, and thank you so much for joining us this afternoon. Nick Seaman and I are joined in the second session by Val Fell and by Professor Margaret McAndrew. I'd like to introduce you to Val first. Val is an Illawarra, New South Wales volunteer and long-time dementia advocate who's been awarded the OAM for her services to her community. She's widely recognised for having turned her lived experience as a family carer into a role as a sustained community leader and also assisting with public education. After her late husband's Alzheimer's diagnosis in 2006, Val became actively involved in what was then the Alzheimer's Association of New South Wales, now a part of Dementia Australia. And since then, she's been a prominent voice for people living with dementia and their families and carers. One of the great joys of any conversation with Val is hearing about her practical experience as a doer as well as an advocate. And she continues to lead the coronal dementia carers support groups in her local area. She's organised the annual Illawarra Dementia Public Forum since 2012, helping to connect local communities with information, research updates, support services, and contributing to broader efforts to reduce stigma and build dementia-friendly communities. Val's advocacy has extended into aged care reform at a national level, and she was a foundation member of the Australian Government's Aged Care Council of Elders from January 2021 through to December 2025. She's also involved with older person advocacy networks, including OPAN over the last 5 years and COTA for 14 years. Also today joining us, we have Professor Margaret McAndrew. Associate Professor McAndrew is a registered nurse with a passion for improving the quality of life and care for people living with dementia. She's an academic in the School of Nursing at the Queensland University of Technology, and she's also a director for our organisation, Dementia Training Australia. As a mid-career researcher, she leads a program of research focused on improving activity and safety for people living with dementia through non-pharmacological interventions, using better assessment tools and person-centred care planning. She's currently conducting a trial of the 3 Ps to getting home safely with dementia, an intervention for residential aged care to support people living with dementia who wander to walk safely. And we'll be talking with Margie today about safety and the dignity of risk in particular. Nick Seaman, you may remember from our first session. Nick is an architect and an environment specialist with us here at DTA. His specialty is supporting ageing and dementia. And as the environmental specialist at DTA, he leads the national training initiatives to develop and implement workforce training to help create more supportive environments in aged care homes. And as an architect, Nick oversees a firm that focuses on aged care, remote Aboriginal health and social services. He's also a lead author of the National Aged Care Design Principles and Guidelines for the Department of Health, Disability and Ageing, and that's the document that we're referring to throughout this series. Nick's committed to improving the built environment in aged care and health services, and he works on projects that enhance care outcomes and workforce capabilities. So Val, I'd like to turn to you to start our conversation today. It's really important to have the living experience inform everything that we do when we're training, but also when we're talking and thinking about the environments. Because while research and design principles are essential, it's really the personal experience of people like you as carers that can really help us understand what day-to-day life looks like. And so where I'd like to start this afternoon, Val, is can you tell us a little bit about your experience caring for your husband and how the environment in which you were caring, the built environment, really shaped your day-to-day experiences?
Thanks, Isabel. Well, the environment began to be important to me when I found I had to take Ian somewhere that was not familiar to him, and we had to navigate the system of getting into and out of a building. That was the first thing that came to mind when you talked about the environment. I needed to take Ian to see a specialist, and the specialist was on an upper floor in a new building. We hadn't been there before. And when I went to take Ian into the lift, he just stepped back in shock and horror. He thought I was pushing him into a hole because the floor had a black colouring on it, and it just looked like a black hole. And so that was the first indication to me that, you know, the environment does have an effect on people's perception of what's going on around them. No way could I get him into that lift. So as a result of that, we had to climb 2 flights of stairs, which wasn't always easy.
You must have gotten very fit.
So, you know, that was the first thing that came to mind. There are lots of little things as far as public buildings are concerned, or even commercial buildings are concerned. And it affects people who have dementia, but also elderly people who are on a walker. Right? And that is the design on the floors. Recently, I went in, I'm on a walker myself, so I'm a participant in the old age system.
Yeah.
I was in a place in Sydney with my daughter-in-law, and we went to walk across the floor, and she was a registered nurse, by the way, so she knew what was going on around her. And there was a pattern in the carpet which was just like a rope going across the floor. And she said, I keep on thinking I'm going to fall over that rope. And that reminded me of the things that used to happen with Ian. You know, he'd go somewhere and the pattern in the floor was always something that may make him divert or fall or something like that, or hesitate, because he didn't quite know where the next footstep would take him, you know.
Yeah.
So, and also signage. If you go to a public building and there isn't any signage and you wonder where you're going next, sort of thing, people, it's essential that all public buildings, including embassy buildings in Canberra, where I had a difficulty trying to visit somebody, and the taxi dropped me at the door, and there was a flight of steps, so I thought, oh, naturally, just round the corner there'll be a ramp. No, didn't exist. So I had to wait. Here and I was, you know, left on the footpath outside this building, waiting for somebody to come past to help me up the stairs. When I got upstairs, I was told, oh, there's an entry down the back, but there was no indication of that.
No.
Right?
And that wayfinding, that experience of signs that mean things too. One of the things that I've experienced myself in caring roles is the way in which we put signs, where we put the arrows, what pictures we have. Sometimes it's really not very clear. And if you're with someone who is challenged by written words or is maybe moving a bit more slowly to comprehend the meaning of a symbol, it can be a really frustrating and anxious making experience, can't it?
Oh, yes, it can be. But and also in big shopping centres and that kind of thing, sometimes the area is so bright and white, it's overwhelming.
Yeah. Those contrasts of colours we know are really, really important as our vision is affected as we age, but also particularly for people living with dementia, to have strong contrasts of colours, because otherwise things do just literally white out and you can't distinguish depth, and you can't distinguish the difference of textures. Did you find in your experience that things like contrasts of colours in the bathroom with the toilet seat, railings, did those things help or did they get in the way?
We need to have positive elements of design around the house as well as in the public areas.
Yeah.
When you think about bathrooms, for example, I was advised when we were having the bathroom rails put in for the shower not to have two horizontal rails, which I would normally have just thought was the right thing to do. But the young man putting in the plumbing said to me, you need one of them to be vertical, because if you fall on the floor, you've got no way of getting up to hang on to the rail because it'd be too high. So you put your hands on the bottom and you climb up the pole.
Yeah.
So, you know, little things like that can make a big difference.
Yeah.
You know, because if you were in the shower and you fell and there was nobody else around, you know, to care for the person with dementia to whom that happened, or even if it happened to me, you know, you could be there for ages. But as far as patterns are concerned on contrasting colours, I think that the colours on seats of chairs should be different to the floor. I've known of somebody who thought they were sitting on the chair, but they were so far over to the edge of the chair they fell down onto the floor because they were the same colour.
Yeah. Yeah, that's a really common one. And I think those sorts of things also matter for things like dining rooms and what's, you know, whether you're using coloured china or something else. I have a very clever teacher who once explained to me that the cruelest meal you could ever serve someone with dementia was poached fish on a white plate on a white tablecloth. She used to say people would go hungry because you wouldn't be able to see the food or the plate or the table. So having those contrasts of colours can actually, it's a very simple thing, but it can have a really profound effect on people's comfort and their ability to be independent for a bit longer and to live properly within a built environment. What were some of your other issues, Val? And I mean, you mentioned about being on a walker, not just having dementia. How is it when you're in spaces that have lots of stuff piled up in the hallways or other obstacles?
You need to be clear. Anywhere where you're walking, you have to ask somebody to move something so you can get through, you know. And that happens a lot, you know.
Yeah.
Or just wait, Val, we'll move the chairs or something like that, you know, so you can get through. People don't always cater for people on walkers anywhere. And that happens in hospitals too.
Yeah.
Because when I was in hospital recently, it was an old section of the hospital, and the hall was cluttered with tables and chairs and people wandering around because there weren't enough beds and all this kind of thing that was going on at the time.
Yeah.
And walking around with a walker was crazy.
Yeah.
You know, you didn't quite know where you were half the time.
Yeah.
So that decluttering, it's something
it's really important.
Yeah. Once you get a diagnosis of dementia, there is sort of for the person for whom you're caring, or even, you know, find things for yourself where you might need changes made. You should ensure that the house is not cluttered, that there are straight pathways, you know, even going from, well, for my husband, I was lucky going from the bed to the bathroom was fairly straightforward, even though it wasn't an ensuite, it was sort of near the bedroom. But I have known of other places where we stayed at various times where it was hard to navigate and you didn't know which door was which. You know, you'd think you were going to the toilet, but you were going to the laundry, you know, because the doors were exactly the same. You know, you were always trying to find out which door is which.
Yeah.
Whereas if you had a photograph of the bedroom, you know, for the bedroom and hand basin or something.
And those sorts of symbols to help guide us are really important, not just because, you know, they make things look more pleasing and having less clutter makes things more pleasing. It's really also about dignity and safety and independence.
Mm-hmm.
And Margie, I'd like to bring you into the conversation now, please. I'd just really like to hear your perspective, particularly given your research on walking safely, about how the physical environment can contribute to reducing triggers for changes in behaviour that can be experienced by people living with dementia, and how some of the factors in the environment might actually contribute to changes in behaviour as well.
Thanks, Isabel. I think what Val said, some of the points she made were really interesting, particularly around the impact on her, and she's cognitively intact. And she has, you know, that crowded environment becomes difficult for her, and to the point where she loses her independence. She needs someone to move a table for her to be able to enter a space. So the environment can either support a person to remain connected, or it can actually stop people from being connected to those meaningful activities or those important activities, and it can actually contribute to change behaviour. Belle also spoke about that overwhelming environment, and often our public hospitals are very overwhelming. They're very bright. There's signage everywhere. There's noise, and there's confusion, even for a person who's cognitively intact. If you're a person who has dementia, then all of this noise and all of the different signages can be very confusing, which can then add to the anxiety that they're feeling, and that can be expressed then as change behaviour. So change behaviour is defined as any sort of actions, emotions or responses that you wouldn't expect for a person of that age or situation. So a person who's in has been overwhelmed by that environment, or the environment isn't supporting them, that might be expressed as things like they can't sit still, they constantly are moving, they might yell out. They might yell out for help, or they might just try and get out of that space. When we talk about change behaviour, we accept that it is an expression of need. So those actions, that change in behaviour, is telling us something that that person isn't able to express verbally to us. So the environment is essential. It's that built environment, but it's also things like temperature, noise, the type of signage we've got, and it's also the number of people in that space and who's in that space.
And that's really interesting, Margie, because after all, as humans, in most spaces, we're interacting with others. I'm wondering if you can speak a little bit about how poor environmental design could unintentionally lead to more restrictive practices where the people in the environment reacting to someone whose behaviour might be changing or a bit challenging. How can a poor environmental design unintentionally lead to more restrictive practices on people?
There's a couple of things that can occur, and it's probably more common in places like residential care or acute care settings, so big hospitals, where things like a locked door or even just a closed door that someone's not able to open themselves becomes a thing that then stops them doing whatever it is they're hoping to do or enter a space that they were hoping to enter. This can be really, so what the area that I study is people who wander, and part of that behaviour is this characteristic called boundary transgression, where they go in and out of other people's private space, and often the response to that is to guide them to another activity. That can be misinterpreted as restrictive practice because effectively that person is in that space because they want to be there, so they're making that choice. But that space also belongs to someone else. It's someone else's private space and they have the right to privacy. So to provide care for both of those people, we do need to guide them out. But we need to offer them another choice. We can't just take them out of the room and expect them to be happy. They're in that space for a reason. So why are they there? Think about the reason that they've entered that space. What are they telling you by being in that space? And then what can you offer them as an alternative? And that then is responding to change behaviour in an appropriate way.
So one of the things when we're thinking about the environments we're creating for people and for ourselves is that we need to think about not just their physical safety, but we need to think about the psychological safety of everybody in the space as well. And that can be a real challenge, can't it, in terms of how the design of a space might shape a social interaction. Val talked about corridors full of leftover furniture, meaning that they were impassable and she couldn't get to where she needed to go. But if we think about dining spaces and living room spaces where there's maybe too much furniture or furniture arranged in such a way that people can't walk around comfortably or sit together and be quiet or enjoy interaction with each other, all of those things can actually impact on the psychological safety as well as their physical safety, can't they?
Yeah, so psychological safety means that person feels calm. They know that space is familiar to them, and it isn't frightening to them. And so an environment that is very busy or an environment that it isn't clear what the space is used for can be very confusing for a person living with dementia, which can then cause them to respond with changes in behaviour. So having spaces that have enough room to move, so not crowded spaces. Val mentioned about the black carpet in front of the lift, and this is their altered perception of what is real is something that many people living with dementia experience, and that's why they'll see a wiggly line on a carpet can look like a snake to them. And so this raises their anxiety. It's frightening to then be in that space. So a space that we're trying to provide, make sure they're safe and make sure they're able to enjoy activities in that space can actually be very distressing to that person. You mentioned that the dining room. The dining room is a really interesting space because it can get very noisy. It is often very crowded in a residential aged care setting. And if you have someone who perhaps has an altered reality, so they believe they're in their own home and they are in their space and suddenly they've got 30 other people in their space, and that's very confusing. What are these people doing in my space? So, doing simple things like changing the arrangement of those tables so that person doesn't see the 30 other people, or finding a calmer space for that person can help with that psychological safety. So they feel safe in that space. They're then able to complete their meal, enjoy that time, and not experience change behaviour as a result of it.
Yeah, thanks, Margie. Val, listening to Margie describe the connection between the environment and safety and the possible impact on people's behaviour, does that resonate with your experiences?
I've heard lots of stories about what happens when people are frustrated because they're locked in and they want to go outside,
Yeah.
So they're frustrated enough to start banging on the doors and people think they're being aggressive and that kind of thing. Whereas if somebody has enough intelligence to look at the background of that person, they will find that they needed to go outside in that particular instance because beyond that door was a garden, and beyond that garden was a field, a paddock with cows in it. Now that person banging on the door had a purpose. He wasn't, wandering, or he didn't want to wander. He wanted to walk with a purpose, and that was to get out there and see how those cows were getting on because he thought they were his.
Yeah.
That had been his reality. And so he came back very calm. So they started to leave the doors open and just watch what he did.
Yeah.
A very simple, solution to what was a problem leading to somebody being labelled as aggressive.
Yeah. And just because we don't know what the purpose is doesn't mean that there isn't a purpose.
Yeah.
Thank you. Nick, I'm going to ask you to join us now and tell us a little bit more about what are the basics for how to design a supportive environment. While waiting for Nick to join us, one of the things that we often reflect on is that the environment is never passive. It can either support a person's purpose and independence, or we can do things meaning well that really get in the way and work against it. So, I mean, some of the things that are really important to think about that Margie and Val have both mentioned is what are the enabling or disabling things we do? Limited patterns, contrasts of colours, clear symbolic signage that truly help us wayfind a room based on its function or its purpose. Val mentioned having a sign on the bedroom that told you this was the bedroom, a meaningful sign on the bathroom that showed you this was where the toilet was or where the shower was. Those are the sorts of things that can really actually help us make sure that we've got an environment that's actively contributing to purpose and independence. Margie also mentioned about psychological safety. We know that without meaning to, we can create a space that causes anxiety and frustration and concern. And Val, I love your story about the farmer and the cows and thinking differently about how care might work in an environment when we can leave the doors open and someone can walk to the bottom of the garden and see the livestock. That surely is a much better way of making sure an environment responds to a person's need. Val, can I ask you, in terms of your experience, were there other things that were really important for you and your husband in terms of public spaces as well as at home?
There was one, at one stage, one of the public buildings was doing some modern renovations, and instead of having toilet doors, which you just pushed open, they had a series of electronic things which you had to push.
Mm.
You know, so unless you were able to understand all that, you couldn't get into the toilet.
Yeah, and I'll pick up on that on those sorts of issues. And Val talking before about floor and furniture matching and being hard to see, and lighting being difficult, or Margie talking about noise, busyness, scale, clutter, all affecting behaviour. We know that people move into care homes with a burden either from dementia or frailty or other issues. And what we talked about in that first webinar was that the environment either helps compensate for those burdens, it compensates for various impairments, or it turns those burdens into a disability. And we've got a legacy of buildings which often do amplify issues. So people are moving in because of difficulty navigating a space. And does the building make it easier or more difficult to navigate? Easier or more difficult for people to be more or less confused? And for me, the principles and guidelines are a really good news story because they're charting a path for change. And whereas the last session was, why environments matter more generally, what I'm going to do is do a brief introduction to how the principles and guidelines are actually a tool. When we were preparing for this webinar, Val talked a lot about how routines and activities are meaningful for different people, different activities, like the example of the cows. And I think that it's important that when we look at any building, we're starting with the social life, we're starting with routines, meaningful activity, and from there we're constructing an understanding of what the environment's doing. So it starts with us knowing the resident and understanding what is meaningful to different people. Alistair Croydon, who's the CEO of an organisation that we're working with in Western Sydney of Holy Family Services, he's said to me last year that on any decision he's making that looks at what he's doing with his service, there are only two questions that he asks. The first one is it good for the resident? And the second one is it good for the staff in that it'll make it easier for them to spend more time with the resident? And I think we can do that very much with an environment. And so today I'm going to go through a brief introduction to the principles and guidelines and 3 examples of where I think an environment is either making things easier or more difficult for activity. And in each of those, I'm really, really thrilled that I'll be talking through those with Val. When we're talking about environments, I think it's important that we're looking at what the environment is both the buildings and the gardens, but also the light, the sounds, the furniture, everything that makes up our experience of being somewhere. And I'm going to focus mainly on residential aged care settings, but a lot of the things we talk about are more widely applicable. So just before we get started, I'm going to go to the next slide, which shows an example of a courtyard. And in this example, I just want to use it to just talk a little bit about what the environment is doing and how we can see structure. So in that next slide, it's showing this courtyard building from somewhere in the north of Italy. And I'll just wait till that goes to the next slide if possible. The issues which, so I'm still seeing the yellow slide. I'm not sure if we can go to the next one there that's showing that courtyard. I'll keep going through anyway. When I look at the courtyard, the image that we're looking at, the issues that I look at are, is that particular courtyard doing something really great for the people who are around it? So in the courtyard, they've got various different shops and places opening onto it. And is it making it easy for people to go to that space, or is it just a space to look at? And in that particular courtyard, there's nothing really to do there. And there's nothing it's not easy to get to it. And so the structure of that space is making it harder for people to actually get to that spot, and harder for them to actually have any reason to be there or anything to do. So now going on to the principles and guidelines themselves, there were 4 key issues that we focused on when we were writing the principles. Those 4 four ideas became the principles that really we built the whole document around. And they were each addressing some issue that we saw in many of the environments that we visited. And those four issues were enabling the person, supporting people being in home-like places, so that reinforcing that sense of home. And the third one is about people getting outdoors, and the fourth one was about staying connected to community. So each of those were enable the person was addressing a lot of those issues that that Val and Margie were talking about, in that it was talking about how do we reduce clutter? How do we reduce noise? How do we address those sorts of issues? The second set of issues looking at home were many people are moving into environments that don't support them retaining those activities that were meaningful to them at home. The third one was getting outdoors. It's a problem in many aged care settings where people have difficulty getting outdoor. And the fourth one, how do we stay connected with the communities that we've been a part of? So I'm now going to go through those three examples. And the first one is one which is of a corridor. Now, I'm not seeing the slides at the moment. Izzy, are you seeing the slides? Okay, you're on mute now. Okay, I'm seeing the yellow slide, but not the slides of the spaces.
We're having a couple of challenges with
That's
progressing
fine.
the slides. So
Val and I talked about these. We can keep talking without the slides. It's really not that critical. So Val and I were talking about different spaces that we spend time, like corridors or living spaces. And here's the image. So before we go into this too far, I just wanted to ask Val, like when you look at these two photos, what do you see?
I see a very uninviting corridor to start with. What's the purpose of that corridor? Where does it lead to? The contrasting light, etc. It's not somewhere where I necessarily want to walk through. And with the other one, the furniture, that's much better. But at the same time, there's not enough room between the chairs and the table for people to walk around. That would have to be moved if some people who were unsteady on their feet, not even on a walker.
And look, the great thing there is the one on the left is a photograph of a care home we worked on a long time ago before the organisation decided to make changes to affect what you're talking about. So they looked at the fact that there's glare, that the floor, it's dark, the flooring is actually not helping. And the changes were interior design changes that were not that difficult. We could put down a new floor that meant that it was a consistent finish all the way along there. We could do things which improved the lighting, and we could do other things which gave people more of a sense of where they were. And so those are things which are the guidelines that sit under that principle of enabling the person. How do we do things where somebody will more easily find their way around? There was a study done about 5 years ago that was done through the University of Wollongong that looked at mobility of people, amongst other things, in care homes, and showed that only 15% of people were independently mobile. And for me as an architect, I look at that and say, I think the environment has a lot to play in that. I think that the setting is reducing people's mobility rather than making it easier for them to get to where they're going. And we know things like if the corridor is shorter, if there are places to sit, these are guidelines that we put into the principles and guidelines. On the right, I think it's quite a pleasant setting. Like, I think it looks more like there are things to do, places to sit, and the issues that Val's raising, which are really like significant issues. Am I worried that I'm going to stumble or trip over something? They're easily fixed because it's moving furniture and because we can make those changes. So with these particular ideas here, we're looking at places where we can make those changes and the guidelines chart a path. The next image is one which is looking at a setting around a meal. And when I was looking at some work to do with early learning, with childcare, the questions that people ask when they're looking at things with kids are, what does lunch look like? Is it something which looks like an institutional lunch within a childcare centre, or is it something which looks like a more normal lunch experience for me? And I think we can ask that same question about many of the care homes that we look at. So Val, looking at this scene here, or you thinking about the different, like what a good lunch looks like for you, do you want to talk a little bit about that?
Yes. Well, it depends on the number of people that I am with. But if I was in a nursing home, I would prefer to go back to what happened where my husband was some years ago. they used to have long tables at lunchtime with people, would sit around it like that one. And some people would, engage in conversations and some wouldn't. But in the afternoon, when they were having an early dinner, they had moved all the tables around so that they were all tables of 4 people. And they all had some flowers on the table. And there was, the tables were set for 4 people. And it was sort of companionable. And the people going there would have a conversation because it was a small number of people. If you get too many people around the table, conversation dies.
Brilliant. And look, I think looking at that, we know that, well, firstly, your first comment went also when we talked through this before is about people having choice and different experiences at different times. And I think we can achieve that when there are multiple places for people to sit and have a meal. So we know that like 60 people or 40 people having a meal together is often noisy. It's not something that we think of when we think of a nice lunch. And so the more options that we give, the better. So if there are places where a smaller group can sit and somebody else wants to have their meal in front of television, if that's possible, that's better.
Because if you're supposed to be home, a nursing home is supposed to be the home for that person.
Yeah, absolutely.
Yep.
And I think that we've just lost your sound there, Val. So I'm going to pick up from that. That the nursing homes being home means that there need to be a range of options for people. So if sometimes I want to have a meal in front of a television, I can. If sometimes I want to have my breakfast at 10 o'clock in the morning, I can. And so that idea of us relating to food means what are the principles, what are the guidelines we think of? Is there somewhere to make the meal? Like, is it a right for me to make myself toast or to make myself a snack? And has that been taken away or made more difficult? So firstly, is there a kitchen I can use? Is the scale small enough to allow what Val was talking about, into what you were talking about in terms of that smaller, more intimate conversation? And are there different choices? And so those are the guidelines that sit under that principle that relates to home, like cultivating home. And
sorry, Nick, I was just going to say that it's a really important thing to emphasise in relation to Margie's point about the environment enhancing psychological safety. I'm going to move you along to talk about the outdoors, please, and
yes,
how important it is to have an outside place with purpose.
Okay, and this is a picture from a care home in Queensland. We've got Natasha Chadwick joining us for the 4th webinar, and this is from the main place that she runs. And looking at this one here, for me, the great thing about this is you've got a garden that's full of life, and I'm working on the idea that these 3 people are actually doing something that means something to them, is enjoyable to them. And again, Val, when we were talking about this this webinar, we were talking about the importance of the outdoors and going outside and what matters to you. Okay, I think we've still lost the sound on you there, Val.
Yeah, that's okay.
So I'm going to keep going and just go through that. When we set up the principle about going outdoors, the 3 things that we were thinking about most were there's a place that's attractive to go, that makes me want to go there. There's places I can sit and actually do things in that place. Secondly, I can see the place that I want to go. And the third thing is I can actually get there easily. The pathway supports me going there. So something to do, a way to get there, and I can see it. Sorry, Val, I think your sound's back on now.
Yeah. Yes. I have found in some of the residential facilities that I have been to where the people in the home had a purpose in doing something in the garden. There was one place where I went where the doors had been from the recreation room out into the garden, which had a wall around it. They couldn't get out in any case. But somebody was going out there and sort of trying to get rid of the leaves. So they gave him a broom and that became his job in looking after that garden. And that was essential to him. And the other people then enjoyed the garden a bit more because it was always tidy and it was always looked nice. And to me, to go out into my garden and see that it's properly weeded and the flowers are out, and it has a calming effect.
Absolutely.
Yep.
And so each of those examples is built around something social. I've got somewhere quiet I can go and sit and I can go there. I've got a nice lunch that I can go and have. I can go outside and do something in a garden, which is fundamental to our physical and mental health. In the next slide,
That's actually really important, Nick, and I'm very conscious that we've got a lot of people putting questions up for us to answer, so I want to leave some time for that. Margie mentioned before about the environments can affect us in lots of ways. I'm wondering if you can just speak briefly to the way in which environments can affect us, Margie, before Nick gives us an overview of a tool that we have that can actually assist with planning good environments. So, Margie, if I can ask you, please, to just reflect a little bit on what are the ways in which our environment can affect us?
So I think we would have all experienced environments that don't suit us, if they're too cluttered or they're too noisy. So an environment can either, as Val and Nick have said, it can be a calming effect, or it can actually cause agitation, anxiety, fear in a person, and these can all be expressed as change behaviour. So a person who, Val mentioned the banging on doors, that person wants to get to that space, but it could be as much, that person is wanting to leave that space as well. So it's really important that we're reading these cues, the non-verbal cues that a person is giving us. They may not be able to use the words to tell us what's worrying them, but we look at that change behaviour to then respond appropriately and help them to be supported and feel calm and at ease in that space.
I'm just going to then move through to what you asked is in terms of the tool. That the slide we're on now is mainly showing how the principles and guidelines are built around going from a scene that looks like the before here to the same setting being changed by even small interior shifts to something which is supporting life in a much more full way. The next two slides just go through, this slide here goes through for principles 1 and 2, how we've broken down what makes a difference into a series of guidelines that sit under each of those principles. So we've got ideas that sit under enable the person, like minimizing clutter. We've got ideas that sit under cultivating a home, like maintaining domestic kitchens and smaller areas. In the next slide, we've got principle 3 and 4. We're getting outdoors like we touched upon. It starts with what's a meaningful outdoor experience for each of the person there, what matters to the resident, and what makes things easier for the staff to support that activity outside. So a dedicated outdoor space for each person, as well as pathways that get us there. And we will touch upon the fourth principle in a few webinars' time, but it's all about how do we stay connected to the community. The final thing I'm going to mention today is on the next slide, which is all about the tool that we developed. And in that this is all about the principles and guidelines, we're all about both how can we build better new buildings, but how can we fix buildings which are a legacy and have got inherent issues. The tool's showing us, it's a tool that we can use to go through and assess an existing environment in order to plan a strategy and go through change. And that's an online tool that you can go through fairly quickly to look at an assessment of an existing environment.
Fantastic. Thank you so much, Nick. And I can really recommend the tool and the other resources that are on the DTA website that can assist people in working out what works for them in terms of good design. And I think one of the things that I've learned over the last little while is that none of these things have to be expensive. We're not talking about knocking down buildings and starting again. Very simple changes can make a world of difference. So this is the fun part. We've already had quite a few questions come through in the chat. So we're going to go straight now to our Q&A discussion. Some of the questions that have come up already. Margie, I might throw this one to you. Can someone living with dementia see digital signs? And does this matter if the signs are changing? Do different colours make a difference?
Certainly fonts make a big difference. wherever the brain is damaged is how that person is then going to respond to that environment and how they're going to interpret the environment. So there will be people who could read a digital sign, but there will be people who may not be able to read them. So it's a very individual thing again, but having signs with clear black font with good size to them at eye level is far better than having ones that are too crowded, too small, too high. So positioning is really important, and the size of the font, and that black bold font is much easier for them to read.
Yeah, fantastic. Nick, how would you suggest improving wayfinding to a room, particularly in an acute care setting? Are there colours or other things that can really make a difference here?
Okay, so the starting point is the actual structure of how corridors are set up. So when we're starting from scratch, it's about there being short lines of sight and there being an easy pathway that goes from a main space, which would be like a kitchen dining space in a care home, or it might be more of a lounge space in an acute setting. So if possible, the most fundamental thing is that ease of a line of sight and an easy access route. Where we've got a situation where you're working with an existing building, it would be about creating a strong differentiation between corridors that tells us clearly when we're in one part or another, as well as there being very strong points of orientation. So something which is a significant element that I look at and say, oh, I know where I am because I'm seeing that. Ideally, something which relates to where I want to go, like I'm seeing something that tells me, go this way, and there's a place that I can make a snack.
Fantastic, thank you.
Can I just add in there, Isabel, if you can't remake a space, that looking at the amount of signage that you've got and make sure that it's not over cluttered, because it can make it very hard to work out which one you're meant to follow. And again, the position of that signage. Being able to read is one of the last things that a person with dementia will lose. So they are still able to read those signs and can sometimes make sense of that as well.
Yeah, I think though you're right. It's a challenge for all of us when there are way too many signs. Had a recent experience of needing to escort someone to emergency, and we were faced with a wall in a corridor that had 16 different signs on it.
Yeah.
9 of which were contradictory. So it was something of a challenge to find where we needed to be. We've had a number of questions.
If we make a space good for a person with dementia, we make it good for everyone.
We do. And we've had a number of questions about who pays for all of this and how do we deal with the budgetary constraints. Nick, I might ask you to reflect on this one, because
Absolutely.
I think you and I are both in agreement that none of this has to be very expensive.
Absolutely. So look, for starters, some of the things that we're talking about are about operational issues or the way in which we set up a space with furniture or even like tablecloths. So we've done some of the DTA training has resulted in people going out and buying some tablecloths in order to make a place more more domestic, or people deciding to go out and get $10 frames to put outside bedrooms where people can put a large picture that relates to them. So some of the changes are really an operational issue. And likewise, and I agree with Margie, that idea of how do we get rid of noise? How do we actually get rid of the clutter? These are often operational issues of setting up things where the kitchen, if it's a commercial kitchen, is closed, not beaming noise everywhere, or a lot of institutional clutter from institutional signage is actually removed from a residential space. The next step up from that, in most care homes, there is some program of, over time, replacing flooring which has gone beyond its use by date. And so we're saying, well, when you're doing that anyway, you're spending the money, therefore let's get it right. The third step up from that are small changes that often people can afford to do, or in one case, we worked on a project where a building was seen at the end of life, and for a third of the cost of replacing the building, they actually changed the building to put another 20 years of life into it. And so that was a financially smart decision. And many of the projects that we do, there's been funding from the department for small changes to buildings which have had a huge impact. and have actually transformed buildings to set up smaller households or to get people outdoors more effectively. So there's a range of different ways of people relating to it, from very small amounts of money through to a significant change that actually fixes a building.
Yeah. Before we go this afternoon, and thank you everyone for your questions, there's way too many for us to try and answer now, but as Genevieve mentioned at the beginning, we will attempt to answer everything and make sure that we post responses so that you can come back and see your question and the response. But Val, I'm wondering if I can come to you. One of the questions that's has been posted is about how we consult with residents and how we consult with members of the community to make sure in both our residential care and our public spaces we're getting the right kind of input, and how do we manage all of the different opinions to move forward?
Well, there are a number of ways you can go about it. Excuse me. With the residential facilities, each residential home should have a residence advisory board. And so you can get them, that person can talk to all the other residents. You know, what ideas do you have, etc. And then they're at a meeting with the powers that be virtually, and say, this is the kind of thing that we need, right? And as far as the community is concerned, this is where we have to, not only in just designing the beds, but in getting the beds in the first place in a home, we need to work with local councils, because they're responsible for the signage on most public buildings. So you need to have a community committee, which should, in many cases, look, don't let me get started on it. It should be at all levels of government. You have to all get together and design community spaces that reflect on the needs of older people, whether it's because of NDIS or whether it's because of just frail aged people and people with dementia.
Yep.
Because as you say, if it's right for people with dementia, it's right for all of us.
Yeah.
And the majority of people in the nursing home have a diagnosis of dementia or have mild cognitive impairment.
Yeah.
So that way, you know, and it's going to get worse. So we need to be sure that the residential aged care facilities have these design principles and not have them shelved as has been done in the past, but put them into operation. And that means getting councils and everybody else, because they're in the forefront of when a design goes through, whether it's going to be passed or not by council.
Yeah,
So therefore they need to be on board.
That's very true, Val. If we really want inclusive communities and real communities in our residential care, then that kind of consultation is a really important thing. I'm going to just do a little bit of a summary for people. And as I said, if your question wasn't responded to in the session today, we will respond to it online. So please check back in and you'll be able to see the responses. I just want to return to a really simple but powerful idea that all of our speakers have mentioned this afternoon. The environment matters, and what we do with it matters even more. We can enable people or we can isolate them and make them unsafe. And so what we do in our environments is a really important thing. And Val reminded us that everyday design features like the flooring and the lighting and too much clutter can really impact on people's independence and mobility and their ability to enter into an embassy and have their business functions take place. Margie reminded us that behaviour doesn't happen in isolation, and very frequently it is a response to triggers in the environment. It can shape how we feel in a really powerful and important way, as well as how we move and whether or not we are connected to each other. Nick has walked us through the principles and pointed out that supportive environments are not accidental. They require us to be intentional and thoughtful about our design and our use of space. One of the questions we didn't really get to today actually made the comment in the middle of the question that having people who understand that and the way in which staff interact in residential care and shape the environment, the signs that get stuck on the wall or not, that's a really powerful influence on whether an environment is supportive or not. And we'd agree. That's why we spent so much time with environmental training. What brings all of this together is dignity. Dignity of a person's living experience, dignity and safety combined, being able to take the occasional risk, like walking out into the garden with not having the doors closed so that you can go and see the cows. Those are really important things for the way we as humans, irrespective of whether we have dementia or not, should be enabled to interact with our environments. The spaces we create communicate something to us and to everyone around us every single day. And they tell us, are we safe? Are others safe? And whether or not they belong. So I'd really like us to be reflecting on the environments that we can influence and asking what's our role in enabling a good environment, enabling people to move and to live within them, to have happy experiences and to be safe. As we've mentioned, today's session was the second of 8. You're going to find a number of other resources on the Dementia Training Australia website, including information on the National Aged Care Design Principles and Guidelines that Nick talked about, and the chat tool he mentioned, the Care Home Assessment Tool. These are all free and will assist you in assessing your environment and where to from here. Thank you so much for joining us today. And I hope you join us again for the future webinars in this series. Thank you.